Good evening. I'm Sierra Williams and welcome to COVID Corner. Last week, I explained that the increased virulence found in the new COVID-19 variants are a result of the favorable mutations in the spike protein. The spike proteins are the protrusions on the viral surface that bind with cells in our respiratory tract. The spike proteins are also neutralized by antibodies, which is why this region of the virus was chosen as the target for all three vaccines now approved for distribution in the US. I know you're wondering, how effective can the vaccine be if it only targets the spike protein? Why wouldn't researchers just create a vaccine against the whole virus? In truth, most vaccines only use a small portion of the virus, typically the region that antibodies bind to. This is because the purpose of a vaccine is to teach your lymphocytes, which produce antibodies, what they are supposed to look for. Think of a vaccine like a bee on the lookout. Following administration of any of the three approved COVID vaccines, your lymphocytes will know to be on the lookout for anything in your body with a spike protein, including the novel coronavirus. Like a bolo in real life, some vaccine types provide a more accurate description of the real virus than others. Vaccines that use a weakened version of the virus provide an accurate description for our immune system. It would be like putting out a bolo detailing a suspect's appearance, the color, make, and model of their car, and their license plate number. Your immune cells know exactly what they're looking for. Now, these vaccines confer long-lasting immunity, usually for your entire life. For instance, the smallpox vaccine was a live virus vaccine and conferred lifetime immunity, which is one reason the disease was successfully eradicated. Today, your measles, mumps, and rubella vaccine is a live vaccine. Other vaccines, while still effective at preventing disease, may not provide lifelong immunity. Vaccines that use a dead version of the virus or a portion of the virus may require booster shots later in life to remind your lymphocytes what they're looking for. So, where in the spectrum do the COVID-19 vaccines fall? The short answer is we don't know. The currently approved vaccines in the US utilize technology that has limited application outside of a clinical setting. The Pfizer and subsequent Moderna vaccines were the first mRNA vaccines approved for public use. The Johnson & Johnson vaccine is a viral vector vaccine. The only other viral vector vaccine currently in use is the Ebola vaccine, which was authorized for emergency use in 2019. So why did researchers stray from the tried and true methods of vaccine development? As it turns out, the manufacturing of these vaccine types is a lengthy process, and the world was in need of a vaccine for COVID-19. Thus, pharmaceutical companies developing the vaccine emphasized those that could be manufactured en masse, like viral mRNA and vector vaccines. The Pfizer and Moderna vaccines are messenger RNA vaccines. Messenger RNA, or mRNA, is found in our cells as well as viruses. mRNA plays a role in making proteins. The mRNA vaccine works like a recipe, telling the structures inside your cells to make COVID-19 spike protein. This process is similar to how mRNA and many viruses hijack our cellular machinery to turn each cell into a viral factory. So why would you want a vaccine to do this? Well, your body is immediately going to recognize the spike protein as an invader, and that cell is going to send out an SOS to your specialized lymphocytes called T cells that will kill infected cells. Additionally, vaccine mRNA can also be presented to your antibody-producing lymphocytes, specific for neutralizing the spike protein. When all traces of the spike protein have been eradicated from the body, most of your B cells that produce antibodies and T cells die off, leaving only memory cells. These cells know exactly what to do when they encounter the spike protein. Should the body be infected with COVID-19, Your memory cells will recognize the spike protein and quickly recruit other B and T cells and teach them what to do, so you don't actually show any symptoms of being sick. The newly approved Johnson & Johnson vaccine also works by creating memory B and T cells, although it does so in a slightly different way. This vaccine works by using a viral vector to deliver the spike protein. This sounds complicated, so let me break it down. Basically, this vaccine involves a common but mildly pathogenic virus known as adenovirus. Adenoviruses cause cold-like symptoms, and most of us have been infected with an adenovirus at some point in our lives, usually in childhood. Adenoviruses are nearly double the size of coronaviruses, so researchers modified an adenovirus essentially by taking out the inside of the virus, leaving an empty vessel that can be filled with the COVID-19 spike protein. The adenovirus particle works as a delivery system, simply carrying the spike protein to its destination. This works because the virus usually has to modify your cells in order to survive. Because of advancements in gene therapy, researchers are able to remove the parts of the virus that allows it to modify your cells, making it unable to replicate. Adenovirus vector vaccines and therapies have been used in clinical settings for years, but the only other noteworthy viral vector vaccine currently in use is the Ebola vaccine. What we know about the effectiveness of viral vector vaccines is largely based on limited studies of the Ebola vaccine, which used a chimpanzee adenovirus. While pre-exposure to adenoviruses can lead to adverse side effects as a result of pre-existing immunity, Johnson & Johnson mitigated this risk through the use of an uncommon adenovirus strain. So which vaccine should you get? According to the CDC, whichever one is available to you. Comparing the three vaccines is difficult, as much of the information on their effectiveness is based largely on clinical studies and doesn't take real-world factors into account. Both the Pfizer and Moderna vaccines appear to be holding up to their touted 95% effectiveness in preventing infection, while the Johnson & Johnson vaccine boasts only 66% effectiveness at preventing infection. It was found to be 85% effective at preventing severe COVID-19 symptoms. It is also worth noting that clinical trial data for the Johnson & Johnson vaccine was collected during the emergence of the COVID-19 variants, while the Pfizer and Moderna vaccines were not. Vaccines are an important aspect of public health and necessary for protecting yourself and others against COVID-19 and other diseases. When searching for information about vaccines, it's important to make sure you're only using credible sources. The Centers for Disease Control and World Health Organization provide excellent resources on how vaccines work, including all you need to know about the COVID-19 vaccines. If you have concerns about obtaining the vaccine, you should speak with your primary care doctor about getting vaccinated. You can also visit coronavirus.health.ok.gov for information on registering for the COVID-19 vaccine and what locations are offering the shot. At the moment, Oklahoma is only offering the vaccine to healthcare workers, first responders, those over 65, individuals with comorbidities, teachers, staff, and students in any educational setting, and essential workers. University Health Services is offering the shot to students right here on campus. You can sign up through the patient portal. I received my second dose of the Pfizer vaccine last week at the Payne County Expo Center. I did experience some side effects the following day, notably joint pain, chills, and a low-grade fever, but these were gone within 12 hours. So if you are worried about side effects, my suggestion would be to schedule your second dose on a Friday so you have the weekend to recover. As of March 24th, Oklahoma had 436,000 cumulative cases and 4,850 deaths. The US has 3 million cumulative cases and 545,000 deaths. Yeah. Yeah. I didn't even catch that.
Yeah, I was like, that feels like we should correct that. It's a pretty big difference.
Yep. Okay. As of March 24th, Oklahoma had 436,000 cumulative cases and 4,850 deaths. The US has 30 million cumulative cases and 545,000 deaths. However, things are looking up, as an estimated 28% of the population has received at least one dose of the vaccine, with 15% being fully vaccinated. Thank you for watching tonight. Join me next time as I talk about common COVID-19 myths and conspiracy theories. For the Daily O, I'm Sierra Williams.